Okay, Bonnie, are you ready for a report on patient in room 448?
Sure thing.
All right, so we have a 50-year-old male. His admitting diagnosis is hepatitis A. He was admitted on April 9th. He's a full code and he has no known allergies. Patient does have a history of hepatitis C. His CMP, CBC, and HAV antibody tests were completed. His AST, ALT, and ALP were all elevated. His bilirubin was also elevated, and his HAV antibody came back positive. The patient presented to the ED with right upper quadrant pain unrelenting times 3 days prior to ED presentation. Upon initial presentation, the patient was hypertensive with a blood pressure of 136/90, tachycardic with a heart rate of 105, a low-grade fever of 101.3, and his O2 sats were low at 94%. His following pain management with ibuprofen, 800 milligram, respirations decreased to 17, and O2 sats increased to 98%. The patient reported pain of 7 upon admission and reports a pain level of 3 as of 2 hours ago after taking 800 milligrams of his ibuprofen. Provider order is 400 to 800 milligrams of ibuprofen every 6 hours for pain. The patient was started on 1,000 milliliters of normal saline at 46 milliliters per hour at 1,400. Patient was given an IM injection of Gamastan one time at 1,600. The ultrasound of liver was ordered but was not completed on my shift. Radiology was backed up and is expected to call within the hour to get the patient down there. Patient has not been out of bed on my shift as pain has only recently been stabilized. There has been no bowel movement and only one void of 100 milliliters. The provider has ordered small, frequent meals, high calorie, high carb, moderate protein, moderate fat, as tolerated when nausea and anorexia subside. The patient has had a poor appetite and has not been willing to eat on my shift. He took only 4 ounces of clear fluid by mouth. The patient lives in home with his wife, and patient and wife have both been educated on diagnosis and precautions. The wife has not exhibited any signs or symptoms, and the case has been reported to CDC. The liver ultrasound still needs to be completed. Presently, pain appears to be controlled. Now that pain is controlled, patient may be more willing to eat. I would suggest continuing to encourage intake. I have noticed on my shift that the wife continues to have difficulty following precautions, and she also needs frequent reminders. This may be something to continue to monitor on your shift. The patient's liver enzymes were significantly elevated, and due to his history of hepatitis C, when I spoke to the physician earlier, the physician was concerned as the patient is at increased risk for acute liver failure, and once the liver ultrasound is completed, he would like to be contacted with the results.